Transgender individuals and HIV in America. Transgender individuals in America face many challenges in daily life. Chief among those is the threat of contracting the HIV/AIDS virus. Since the CDC has started tracking this disease among the transgender population, they found in 2015 that transgender men and women test 3x higher than the national average for being positive with the HIV virus. We all know by now, since this virus first made its debut in the 80s, that it is a preventable disease. With proper protections, you can limit your chance of contracting it. However, in the transgender population, just between 2009 and 2014, 2,350 transgender, gender non-conforming people tested positive. 84% of that testing positive were transgender women. Why? Some of the reasons these individuals tested positive is because of their living conditions. Homeless, unemployed, IV drug usage are some of the factors. Violence. Lack of familial support adds to this as well. Most of these new cases were women of color, Black, Latinx, etc. that lack most if not all their basic living needs. In the southern United States, this is multiplied due to religious beliefs and the growing racial inequalities there. Lack of proper quality medical care adds to this dilemma, as doctors are not trained to handle the transgender patient and all their special needs. Lack of compassion in the healthcare industry fuels the discord between patient and provider. Staff in medical offices, unless they are specifically trained, do not understand that even misgendering an individual can have devastating consequences. Some of the risk factors transgender individuals face are sex with multiple partners, anal or vaginal unprotected sex, IV drug use, and sharing of dirty needles also contribute to the rise in cases we are seeing today. Major life-altering situations such as homelessness, incarceration, unemployment, which are societal factors, play into the higher-than-average numbers as well. Add to all that the stigma and social rejection even with the LGBT and the biases that it shuts them out of representation within their own community. With funding cuts at the federal level of our government, we need to individually speak to our elected officials, work with organizations such as the Solano AIDS Coalition and Solano Serenity Center to effect change. With approximately 2% of the high school population identifying as transgender, gender non-conforming, this is where it needs to start. When talking to elected officials, having them earmark funds for education and prevention efforts are what is needed. By providing stable housing and employment, statistics show that HIV rates plummet in all categories. Discrimination in employment, even with college degrees and experience, hold many women at bay, leading them into risky sex work and drugs to numb the effects. This vicious circle of unemployment, underemployment, and discrimination needs to be curtailed. In California, there are currently bills designed to give transgender individuals a fighting chance at being whole, which is demonstrated will drastically lower new infection rates. Comprehensive testing and accessible medications are needed for those already infected with HIV. By providing even medical-grade cannabis to those infected with the virus will help. It helps with the nausea or headaches associated with certain combinations of drugs used to combat the virus. The cannabis also will help those in later stages of AIDS when they need pain control or weight balance to keep their body functioning somewhat normal. Lifespans which once were months are now years, some even decades longer than first thought. Pushing for social change within ourselves and those around us that we influence makes a difference. Being transgender places me at a higher than normal risk for contracting the virus, but through education and preventative measures, I lessen my chances every day. As a transgender woman, I see this all around me. I experience many facets of this, but through these changes I have mentioned, we may one day eradicate this disease altogether.